Hey nurses, looking for exclusive discounts? Nurse.org has you covered with deals on everything. Save big on the essentials you need to excel in your career. Don't miss out. Visit nurse.org/discounts for the latest discounts made just for you. You're listening to Nurse Converse, presented by Nurse.org, a collaborative podcast amplifying diverse nurse voices. Get ready for a dose of inspiration, a sprinkle of education, and a whole lot of community.
My name is Stephanie Suzadail, and I'm going to be your host today, joined by Everett Moss. We have a really interesting episode lined up for you today if you've ever wanted to know anything about flight nursing. I've been a flight nurse for over 6 years now, and it's all I've ever wanted to do from the time I was an EMT in high school to every day I get to wake up and go fly again. Flight nursing is an interesting field blending the best of critical care and emergency medicine, sprinkled with a little aviation and a whole lot of excitement. Today, we're going to talk about what a flight nurse is, what they're typically responsible for, as well as the minimum requirements to become a flight nurse. We're going to discuss two very different journeys into flight nursing. So my co-host today is Everett, also known as the Paramurse on Instagram, and he currently works as a nurse anesthetist. However, his journey before that was very fascinating. In addition to being a phenomenal provider, Everett is a voice in the community sharing his passion for critical care and emergency medicine, as well as encouraging diversity in his field. But you don't want to hear from me about him. I'm going to let him tell his own story. Everett, thank you for joining me on this episode. I am really excited. Can you tell our listeners a little bit about why you got into flight to begin with, as well as the journey that brought you there?
Absolutely. Happy to be here. Happy to be on the show with you. I feel like it's been a long time coming that we collaborate on something. So here we are. My background began in EMS and fire. So quite naturally, that was my introduction into flight nursing as a whole. Just overall being in the ER and seeing the flight crews come in and drop patients off while I'm dropping patients off or either doing clinicals in the ER. And it was always a big mystery of like, who are those people? Everybody's kind of in awe of the flight crew as they walk in. So wanting to be a top tier provider, wanting to, kind of reach the pinnacle of my field, that was my intro into flight nursing. And essentially, I started as a flight medic and then later on transitioned to flight nurse. So that was kind of the short version of my introduction into flight nursing. And as you said, it's an amazing field, great scenery, and great opportunities.
Thank you for sharing, Everett. My journey also started in EMS. So if you've ever read my blog or seen me on Instagram, you'll know that my journey in EMS all started with a boy who shattered my heart. And, what do we do with our broken pieces but try to go help other people put their pieces back together? So my start was a shaky one. I started in high school in an EMT class, which was full of firemen, and I got myself a little distracted there and failed out within like the first week or two. And this is probably going to hurt your soul. I failed out in an airway.
Oh, no.
So anyway, I failed out. I came back the next semester, kind of doubled down on it and did really, really well, like completely rocked the class. So 17 years old, got into EMS, joined fire, did all that. So I went to school, originally was accepted for nursing and decided when I got there, I want to go for pre-med because, I want to be a doctor. I don't want to take orders. I want to give them. Well, that didn't work out so hot for me. I had a lot of struggles my first year in college. I took a course overload. I partied a lot. I was very depressed. So of the 48 credits I took my freshman year of college, I got a whole 4. that I passed. Wow. So oh yeah. So from there, my mom yanked me right out of school, put me at a different school for paramedic. And from there, I decided, you know what, I want to go back into nursing. So I finished my first year of paramedicine, loved it still. I saw emergency medicine and pre-hospital medicine will always be near and dear to my heart. And then from there, while I was in nursing school, I was also a volunteer EMT and firefighter in my area. And we had a really bad accident where 2 teenagers got pretty hurt. One did inevitably pass away, but the other was mine. And I got to get him all ready to go to be flown to a local trauma center. And it was the absolute awe of seeing this woman getting out of a running helicopter, pulling her helmet out, doing like the Baywatch hair shake, And I was like,
Yeah.
I want to be her. It's just all together. And she was so calm, so collected, like just went through this poor injured child. And, I just wanted to do that. So, that was the defining moment for me, as well as when I was 23, I was treated for a stroke and flown in a helicopter to my major tertiary center back home. So that particular aircraft, which is a whole nother story, which if you've ever read my blog or see my Instagram or anything, you'll hear this story about how things come full circle. And I was actually a flight nurse on that helicopter, transporting a stroke in the same exact unit I was transferred in. So when I say things come full circle, they really, really do. And that is why I personally got into flight nursing. Now that we discussed our reasons and routes for becoming flight nurses, let's really dig into what a flight nurse is. Everett, how would you describe flight nursing to somebody who's never been exposed to one before?
I would describe flight nursing as an emergency and critical care combined nurse that is able to practice in a distant environment without a lot of resources. I mean, that's essentially what they do. We handle some of the most critical patients and some of the most acutely critical patients, as well as the chronic. And being able to use all of your skills and training to make a decision based off a set of protocols to essentially keep the patient alive, hopefully not any worse, until you get them to the place where you're transferring them to.
Yeah, I think that's a great description of what we do. I feel like at times flight nursing is a whole lot of crazy with a whole lot of boredom sometimes. I mean, we have those periods of time where we sit and we're waiting and for something that may never come. So you kind of have to be able to balance this whole watchful waiting, but not getting complacent and letting your skills slip and letting your knowledge slip. I feel like with my particular job, I work 24 hours. So in between trying to make sure, all my aircraft is checked, all of my skills are completed for the quarter, all my education's done, I'm resting. But if you don't fly at all, that's just a whole lot of resting. And I've pretty much seen the entire internet some days. Like I'm from start to finish, I've probably watched everything on the internet. But that being said, flight really is a dynamic field. I feel like when I come into work, I have to be ready for literally everything. The work isn't the same day to day. And this. One day we're going to be flying a heart attack to a cath lab. Another, I'm going to be transferring a high-risk obstetrical patient to a tertiary facility about 3 hours away, which is probably 9 hours away by ground, something like that. Especially if you're more remote. Other days, we're going to have these multi-trauma vehicle accident patients that we're intubating and starting blood. And then we're on the next flight out before we even get to eat lunch. We're going out on a child that needs a pediatric center for some form of heart defect. And I think as a result of this dynamism, flight nurses just really need to be experts in a little bit of everything, as well as being able to work beside flight paramedics in these often seemingly austere conditions. And for that reason, training just never stops.
Yeah, I agree with you. It's definitely a very broad skill set. When you work in the hospitals, you typically, short of our ER nurses, I think ER is the only place where you don't know what's coming in the door next. But if you work in the adult ICU, be it cardiac, be it trauma, be it medical, be it neuro, you kind of know about what's coming in, so to speak. You know what I mean? Because you're kind of
absolutely
unit specific. So anyway, I think that's a great point you made, that you have to be ready for whatever comes next. And you have to go from 0 to 100 really, really quickly. You're sitting down exploring the entire internet. And then the next thing you know, you're taking care of this, heart defect or this stroke or this trauma.
Right. And, I think for that reason, flight is just such a humbling field. I feel like I am humbled so many times because there are just so many ailments and injuries out there that all have different treatment plans and affect different populations. So right now I'm flying out Southwest, where I normally had flown in the Northeast, and the populations are very different. So therefore the ailments in these communities are very different. Attitudes on preventative medicine are very different. So you just never know what you're going to kind of get into. Now, I think this segues kind of really well into my next point. I feel like there's a lot of things I wish I would have known about flight before I went into flight. So this next part really is for the aspiring flight nurses and maybe even the new flight nurses. let's talk a little bit about the things we wish we knew in this next couple of tidbits of advice. So, Everett, if you could look back on when you were a brand new flight clinician, we'll say clinician because, I know you segued in from being a flight medic.
Mm-hmm.
What do you feel like you wish you would have known then that you know now?
I honestly can't say there was a lot that I wish I knew, so to speak. I think that anytime you're going into any profession, doing your own research and due diligence about the profession will just help you better prepare your mind and your strategy for being successful in that profession. So doing your research in the profession really allows you to have the mindset, allows you to prepare the things, your strategy for being successful in the field. I think that would be the biggest thing for me that I wish I knew, because overall, flight, you get linked up with a lot of good people who are really passionate about what it is that they do. And I feel like they do a really good job of taking you under their wing and really showing you the way, so to speak. As you mentioned, a lot of times flight nurses will get paired with a flight medic who most of the time may have been doing this for a while and kind of like, puts you on their hip and kind of carries you as you find your way. And the same thing, when you're a new medic, you have an experienced flight nurse who kind of carries you along, gets you off the truck mindset and into the helicopter mindset.
Enjoying this episode? We want to hear from you. Share your feedback and support your favorite host by completing a quick survey, and you'll be entered for a chance to win a $50 Amazon gift card. Head over to Nurse.org/podcast and let us know what you think.
Right. And it's so interesting, the duo of a paramedic and a nurse, because you think back, you go to a lot of these blogs or the meme pages where, it's always pre-hospital versus nursing and, but then you really come together in this particular aspect. There's so much empathy, I think, because you're both expected to operate to the same standards in most companies. So generally, to the listeners out there who may not know this, once you hit the flight environment, your flight paramedic partner and your flight nurse partner may be completely interchangeable. So you'll see paramedics that are operating these Impellas or nurses that are putting tubes in various orifices that we don't normally put tubes in, like intubation and chest tubes and so forth. So I wasn't sure where I was going with that. I needed to save myself. And the thing is too, is that in learning to operate with this new profession, you're going to often encounter sometimes some difficult personalities. You guys are not always going to jive together. Pre-hospital paramedics generally have this stabilize, move on. Like the time spent with patients doesn't compare really to what you do in nursing. Nursing, we could have them for anywhere from 2 hours to 12 hours to, it's my third shift with Mr. Johnson down the hall. My goodness. So, the mindsets just and the prioritizations may differ. When I am working as a senior flight nurse with younger flight nurses, especially ICU nurses, and this is I'm not dogging on ICU nurses. I love you dearly. You do struggle sometimes with, a line is a line is a line. That 22 in the thumb, I know it's not the best for leave-a-fed, but guess what we got? It's that or it's drilling the bone there, guys. So trying to just get used to this environment and get out of your comfort zone and learning how to do more with less is definitely something, I feel like I knew as an EMT, but didn't really appreciate until I started flying.
Yeah, I'd agree with you. And I tell people oftentimes, some may not agree with this, but hear me out. I feel that when folks are in nursing, they're like, hey, should I go to the ICU or should I go to the ER if I want to be a flight nurse? I tell them ICU. And the only reason why I say ICU is because the medic typically has a lot of the ER stuff in their cocktail, but they don't have a lot of ICU stuff in their cocktail. So when you pair the two together, I think it blends in a surface level. What's the best pair? But again, it's not a dig at my ER nurses. They're complementary, absolutely. But I know you can absolutely be successful as an ER nurse coming in.
I was gonna say, don't come for me because I came from ER.
Yeah. Well, because that's my background too. Now, You know what I mean? So
I
but as an ER nurse though, sometimes if you don't get that opportunity to hold those critical patients, mess with
Right.
those
You don't
critical
see
drips,
those
it's a
skills.
little bit of a pucker factor the first time you walk into that
Absolutely.
ICU and you have 8 drips, a vent, and all of the things that you're not used to seeing every day. You figure it out, but it's not
Right.
as
Yeah.
comfortable as it is just like for the ICU nurses. It's not as comfortable for them to do a RSI in the field on the ground, with no physician
Right.
there.
Oh,
So
and let me be real here. I used to fly in Amish country, so sometimes it's in a field in cow poop.
yeah,
I can't
yeah,
tell you how many times I've found various poops on me, and not
yeah.
just human poops, so many poops. So I think you brought up a really good segue point of what are the qualifications and where is best to go. And, I think we should also, I want to put an asterisk on this that, when we're about to say what the minimum qualifications are,
hmm
minimum qualification does not always mean qualified. It
Right,
depends on what your
right.
experience is. And I'll kind of circle back to this thought here. But in my route, I already said I came from the ER. In order to become a flight nurse in a program that is accredited by CAMES, which is a organization that looks at safety of different programs, they often recommend that you have at least 3 years of critical care experience. Critical care experience often means emergency department or ICU. It does not mean medical surgical. It does not mean OB, although you may be high risk. And there are some hospitals that will run specific obstetrics or pediatric or NICU teams out of their own hospital. We're talking more of like a community base or like paramedic nurse combo. So let's just specify that specifically. There are teams that are very specialized, but we're talking about your general run of the mill flight company. They want you to have experience in the emergency room or the ICU, or the alphabets. So your ACLS, your PALS, your BLS. Additionally, they want you to have NRP for most of them for neonatal. What else, Ev? Trauma.
Yeah. So I think the the entry level, is to have your nursing, of course, like you said, ACLS, BLS, PALS, NRP. And then a lot of them do want a trauma course. Sometimes I know some companies are a little bit flexible on when you get that trauma course, but some want it on entry level, your PHTLS, your ATCN, or TNCC, or one of those
Right.
combinations.
And to that thought too, your company may accept a certain trauma, but then depending on where you're getting accredited in the state, they may want something completely different. My partner is
Absolutely.
literally just going through this for California right now. So, that being said, having all of these different credentials and having years of experience, we're looking at least three solid years. And when we come back to the whole meeting minimum qualifications doesn't mean you're qualified, you need to be able to look at a patient and kind of see what their trajectory is. So your experience should be having a diverse amount of patients, having a diverse amount of different ages, having lots of cardiac, having lots of trauma. You want to make sure that your experience is well rounded and that you comfortably feel like you're an expert in your field. We look at the whole Dunning-Kruger effect, where the longer you've been doing things, the more you realize how little you actually know. That
hmm
is true
hmm
in flight. I am humbled all the time. Ev, you moving on to anesthesia, I'm sure you're still humbled daily.
Absolutely. And to your point, I've actually kind of flipped the way I say it, and it's because of being in so many different areas. I now say I'm no longer humbled because I go in the door humble, but I know what
Oh
people
yeah,
mean when
that's
they
that's
say
great.
it.
I love that.
You know what I'm saying? Because the to truly be humbled, right? You would have had to go, "Oh, I got this." No, I don't walk into any scene, any room,
Oh
any
yeah.
procedure no longer like, "Oh, this is gonna be easy," because you will get hit in the mouth harder than Mike Tyson.
Oh,
you
that is a
know.
great point. I am so glad you brought that up. Yeah, that is a phenomenal point. So, as we stated, we'll break it into a box, just a bullet point box right now. 3 years of experience in critical care, ER or ICU. Whatever it is, make sure it's high acuity. We're not
hmm
talking small community transfer out. kind of experience where you don't have the chance to manage your patients for a little while. Now, that being said, some critical care access hospitals can, like, they are everything. They're
Oh,
RT,
yeah.
they're X-ray. Like, it's wild. There's a 2-bed ER north of me that does magic. I don't even know how these nurses do it, but God bless them. But we're looking more for like churn and burn. You're seeing a ton of patients every day. You're seeing a variety of patients every day. And in ICUs, like, we want high acuity ICUs. Make sure you're getting those drips. I often say that CV ICU or neuro ICU are probably the most useful ICU nurses I personally have ever worked with. That doesn't mean that, a medical surgical ICU nurse is not useful. You all are, because you know a lot more drips than I do as an
Mhm.
ER nurse.
Don't sleep on surgical trauma at a high acuity trauma facility
Sorry, yeah,
because
for me, that means neuro
yeah,
usually, but
I
yeah.
got you. And but to your point though, that is something that you have to take in mind whenever you're listening to something like this. When we identify a unit, it's based off how we know that unit to be. Because like you said, neurotrauma, where I was, those two were separate. So just know that
Oh, yeah.
regardless of the name of it, we're talking high acuity, uh, high census, a lot of drips, a lot of surgeries, a lot of procedures, a lot of things
A
happening.
lot of lines,
Yeah.
a lot of specialists. Yeah. That's a great point. Thank you so much for bringing that up. So, generally speaking, what your experience is should really be dictated by where you wish to fly in the end.
Mhm.
So, if you're going to a company that does 100% IFT transfers, interfacility transfers, you'll hear me say IFT occasionally. You're really going to want to look for more ICU stuff. That being said, I find that ER nurses do a lot better with pre-hospital scene work. Where I
Mhm.
am right now, we're about 90-10 to 70-30 split, where we do a majority of pre-hospital scenes. ER nurses come a little bit more prepared to deal with children, deal with regular adults, deal with elderly adults, obstetrical patients. We have a little bit more diversity, and we're not seeing quite as many lines and tubes that you would in an interfacility. ICU nurses, fantastic. When I have to take one ICU patient to another ICU, because I don't even know what that box is sometimes, I'm going to have to rely on somebody like, okay, what's this one do? And what's this line? And it's a CV what? That being said, it's something I've constantly have to brush up on time and time again. But if you know where you want to fly, so you want to go to a rural flight program that does a lot of scene transfers, maybe go more for your ER. If you want to work in those inner city hospital-based programs, maybe go more ICU. There's no wrong way to skin the cat. What it comes down to is your willingness to learn and your devotion to making learning lifelong.
Let's see how you agree with it. If you agree with this, Steph, if you are getting into nursing and you know that the goal is flight nursing, we've already established that it's going to take about 3 years for you to gain experience to be successful. My suggestion would be if you start out in the ER, after you've done a year or two ER, see if you can either transfer or pick up or cross train in the ICU. Vice versa, if you start in the ICU and after you get
Mm-hmm.
a couple years, see if you can cross train or even transfer to the ER. And in that way, when you achieve your 3 years, you will have a little bit of both areas so that you have a more diversified experience to bring.
Absolutely. I 100% agree. There is no shame in cross training and trying to get as much experience as possible. Heck, I even think, let's say 2 solid years of ER, go part time there, do 2 solid years of a high acuity ICU,
Hmm.
golden. Mwah. Now just add
Hmm.
some 911 experience in there. Not necessary because we got our paramedic partners most of the time. But man, that's just the icing on the cake. Truly could not
Absolutely.
phrase it better myself.
Yeah, definitely.
Absolutely. Truly, truly awesome field. Absolutely love it. Well, Everett, do you have any last minute advice for our listeners today?
I will say this definitely if flight is a goal of yours, try not to listen to them and they that have never done it. Be aggressive with your networking and try to connect with some folks who are actually flying. Go by a base, talk to them, pick their brain, and just really learn about the profession that you dream about. The worst thing that you can do is allow those who haven't done it to kill that dream or discourage you from achieving that dream. So keep dreaming, connect with some good folks who are doing it, and I think you'll do well.
Well, everyone, that concludes our episode on flight nursing here on Nurse Converse. Thank you for joining us, and thank you, Everett, for your excellent co-hosting. For those of you who want to hear more about Everett, check out his episode where he discusses his road from paramedic to CRNA, which is a fantastic topic. And remember to tune in next week for another great episode brought to you by nurses like you. And as a quick reminder, if you found this episode insightful and or entertaining, please rate and review the podcast. Be sure to mention me and Everett by name if you'd like to hear more from us. Finally, be sure to share with your friends who might be interested in flight nursing. Thank you, guys.
Thanks for joining Nurse Converse, brought to you by Nurse.org. Help us grow by leaving a 5-star rating and review on your favorite podcast platform. Nurse.org supports nurses with career and education tips, life advice, and breaking news. Thank you for all you do and for being you.